This is particularly important for those patients who are aesthetically very conscious and they want a kind of a treatment in which the classical orthodontic appliance like a fixed appliance should not be visible on their teeth, and they can show to the society and to the community that they are not getting any kind of treatment. So this could be the appliance of choice for those patients who are aesthetically and very conscious. So in today's lecture, we are going to discuss about the limitations and pros and cons of the removable appliance. What are the advantages we can get from this appliance and what are the limitations with these appliances? Okay, we have different kind of orthodontic appliances. Broadly, we can categorize them into the removable and the fixed one. Removable, we call it for those appliances which the patient can remove from their oral cavity, and fixed appliances are those which are fixed, but the patient would be unable to remove the appliance from the oral cavity. However, the dentist or the operating orthodontist could remove the appliance. This definition is completely based on the patient's criteria. If the patient can remove the appliance, we could call it as a removable appliance. If the patient can not remove the appliance, we would be saying as a fixed appliance. These are the classical fixed appliances which we see every other day, and appliance and contrary. But these appliances have the main issue of the visibility and a kind of a metallic look that is classically attached and associated with these kind of the appliances. For the to solve this problem, they have invented a different kind of treatment modalities. One modality is the lingual appliances, in which the appliance is totally installed and they placed on the lingual aspect. So this is the latest version of a kind of removable appliance. These are called the aligners, and the aligners are totally based on the CAD/CAM system, in which the computer-assisted manufacturing and computer-assisted design is there, and the tooth movement are virtually executed on the computer, and a milling machine would be there who would be fabricating the appliances for that patient, and these appliances just materialize the computer assisted design. This is another kind of removable appliance. In this appliance can be removed by the patient, and this is used for the growth modification of the patient, and this just keep the mandible forward, in a protruded position, and stimulate the growth of the maxilla. And you have already know about it. Okay? This can restrict the vertical growth and the sagittal growth of the maxilla as well, having the headgear-like effect of these appliances over the maxilla. All the functional appliances have like headgear type effect. So moving on, okay, this is a kind of a removable appliance. This keep the mandible forward in a particular position, and this stimulate the this temporarily stimulate the growth of the mandible. The removable appliances are those appliances and devices which are inserted and removed from the oral cavity by the patient at his will. Okay, so one of the classical advantages is that they are invisible, and the visibility is extremely important for those patients who are socially very active, and they do not want they are having any kind of the cosmetic treatment. Okay. However, we are discussing about the advantages of the removable appliances. There are many advantages. One advantage is the less visibility. Other advantage is with the issue with the fixed appliances is like this. Okay, you can see over there that the patient, this is very difficult to have a good oral hygiene in the presence of these gadgets. What we can say, the natural cleansing mechanism of the cheek and tongue is completely impaired due to the appliances on the label aspect of the teeth. For example, what we already know from the previous knowledge, okay, the incisal two-third is cleaned by the cheek and tongue movement. With these appliances, you would have a lot of the plaque retentive site and plaque retentive area. Okay, and this is the advantage of the removed appliance. Once you remove the appliance, and you can maintain a very good oral hygiene. Whenever the patient eat or drink anything, drink other than water, then he or she it's definitely supposed to remove the appliances. आप
जी
हमेशा मरीज को ये कहेंगे कि removable appliance उतार के आपने कुछ खाना पीना. ठीक है। वरना जो हम आज इसकी बैठ के इतनी तारीफें कर रहे हैं कि वाह जी वाह, रिमूवेबल अप्लायंस तो बड़ी जबरदस्त है, प्लाक रिटेंटिव का नहीं होगा, या वो
जी।
इसके साथ बहुत ही हाइजीनिक अप्लायंस है, वही हाइजीनिक अप्लायंस
हम्म।
जो है वो रिजर्वायर बन जाएगी। फिर उसके बाद रिमूवेबल अप्लायंस में ये बात है कि जो जब भी आप मरीज को ये कहेंगे कि जब उसने सफाई करनी है, कॉमन सेंस क्वेश्चन है कि जब पेशेंट ब्रश करेगा तो उसका अप्लायंस मुंह में लगी रहनी चाहिए या नहीं लगी रहनी चाहिए?
नहीं लगी रहनी चाहिए सर।
Increase. So if we compare the fixed appliances with the removable appliance give a less precise control of the tooth movement. But however, with the fixed appliances, we have a very precise and good control of three-dimensional control of the tooth movement. Here we can do border tooth movement, and the complex malaclusion can be treated as compared to the removable appliance. Only a simple malaclusion can be treated, but however, it's a very cheap appliance. Coming to the Anchorage situation, here the Anchorage requirement is quite less, because Anchorage requirement is less because we can give only a tipping movement in the removable appliance. However, in the fixed appliances, the complex and a very complicated kind of tooth movement, especially the body to tooth movement and the up root uprighting and the root movement are basically executed. So that's why the Anchorage requirement in the fixed appliances is much greater, because here the bodily movement or root uprighting, the apex movement of the apexes are executed in this modality of treatment by the fixed appliances. However, the removed appliance only the tipping movement, which is the simplest form of the movement that is executed. That's why, however, another reason is in the removable appliance we have a whole palette. So the whole palette uh, can be used for giving the anchorage. However, in the fixed appliances, we cannot use the full palette. However, an appliance which is called the dense appliance can be used for giving anchorage. The simple my message is this, that the anchorage requirement in the removable appliance is quite less because of the simple tooth movement and mainly the tipping tooth movement. However, in the fixed appliances, the anchorage requirement are much greater because of the movement of the apices and unavailability of the whole palette for using and for providing anchorage. So here in the fixed appliances we can use multiple tooth movement. This can be used in the upper and the lower arches. However, the removed lines in the lower arches are notorious, and because of the retention problems are because of the inclination of the teeth and because of the high undercut area in the lower arch. So removable blinds are very popular in the upper arches, but in the lower arch, because of the high undercut in the lower arch, it's not very popular in the removable appliances are not very popular in the lower arches. With the removable appliances, it's very difficult to control rotation, because for the rotation correction, we need a 2-point contact area. However, with the fixed appliances, we can use a 2-point contact area, and a couple movement are quite possible in the fixed appliances, so they are much better to control the rotation. Coming to the oral hygiene, as the removable appliance, these can be removed by the patient at any time, or at any social event. So the removable with the removable appliance, we all know we do the brushing after the removal of the removable appliances. So the oral hygiene is quite better in the removable appliance. However, if we include the aligners as a removable appliance, we need to be very careful for the fizzy drinks in case of the aligner, because they can be a plaque harboring site for the fizzy drinks if the aligner if somebody, a patient, drink along with the aligners. However, one of the limitation of the removable appliance is the dependence or the compliance, because all the success is dependent upon the patient, because if the patient has to wear the appliance for producing the good results. So majority of the success is dependent upon the compliance and wearing of the patient. However, in the fixed appliances, we are not so much dependent. However, we are dependent for maintaining good oral hygiene. We are dependent for regular appointment schedule for the proper supervision of the case. But as compared to the removable appliance, the compliance is not so much required, because the patient do not have to wear and remove the appliance. So this is the reason. In the fixed appliance, there is a long chair side, but in the removable appliance, there is a chair side time and chair side appointment is quite less, because the fixed appliances are quite complicated in term of management. Uh, that's why the extensive training is required to manage the fixed appliances. In the removable appliance, we do not require a complicated or very long duration training for management of the removable appliance.